Crown Council webinar, That's Way Too Much Money, presented by Tanya Bailey, who is one of our practice advisors at the Total Patient Service Institute. We're excited to be able to present this. This is a financial arrangement seminar for the entire team, and we'll talk about that in just a minute. So our presentation here, we have a formal presentation followed by any questions that you might have. You're welcome to submit those questions at any time in your control panel on your question box in the control panel, and we will address those questions at the end of the formal presentation. By way of reference, today's webinar is a continuation of a series. Each year, we do a financial arrangements webinar at the Crown Council. You're welcome to go back and view previous financial arrangements webinars by going to crowncouncil.org and click on the training section and the webinars. And we recommend that you watch I Can Afford It, as well as 50 Ways to Pay, which talks about all the different ways that patients can pay for treatment. So those are great resources. We'll be adding to that body of knowledge today. This webinar today is designed for the entire team. And the idea being that it's the entire team's responsibility to tee up the patient and tee it up for the financial coordinator to do his or her job. It's not just a financial coordinator's job, but it is the entire team's job. It is a full team sport. It's not just the financial coordinator's job to wrestle with the patient and see how they can get them to accept treatment. And we'll talk about the entire team's role today and all the different things that they need to do to have successful financial arrangements. So with that, I know most of you are familiar with Tanya Bailey, who is one of our practice advisors at the Total Patient Service Institute. Tanya has many years of experience in dentistry and travels the country all day, just about every day of the year, in practices implementing top systems. In fact, she is at the Admirals Club waiting to fly out to a practice as we speak. So, Tanya, thanks for joining us today, and looking forward to what you have to say.
Excellent. I'm happy to be here. Thank you, Steve. So just kind of a highlight of the objectives we're going to cover today. We're going to talk about how to clinically set things up for success, and then how to link it up. We'll cover the tools you need, the final presentation, and last but not least, tracking and follow up. So as we tee it up in the practice, we have to set our financial coordinators up to get the best results. If you can change that slide, Steve. We're going to tee up the financial coordinators. It is, as Steve said, a team sport, not an individual wrestling match by the financial coordinator with the patient. So we're going to cover everyone's role. I don't think I see the slide moving.
That may be a problem.
So, technical glitch at the beginning here.
All right.
Wait a quick second.
I have on my screen the intro camera picture.
I just see the cover slide. That's way too much.
Got it. All right. So, let me see what I can do here. Hold on.
So while he's working on that slide, when we talk about teeing it up, as we prepare in the clinical arena for our financial coordinators to get success, it really starts with the communication that we have with the patient in the room. We all know that patients don't buy solutions to problems that they don't perceive themselves to have. So the first thing is to make sure that we have a clearly agreed upon condition. So we want to get the patient involved in discovery. And the best way to do that is, you've got it, that three-letter word, just ask. And then in addition, create it to be a visual presentation. So the best way to do that is with your camera, and get those photos up on the screen so the patient can see the problem and start asking questions for the solution.
Just quickly, are you still seeing the cover slide?
I am still.
Yes. Do you want me to move this over to her, Steve?
Yeah. we could try that. Tom, do you have it up on your screen?
I do.
All right, let's try that.
I don't know how to make it move, though.
There we go.
Oh, here we go. Hmm.
You know what? I may have just solved it. Thanks for your patience, everybody.
Can you still hear me?
We can. You're good.
Okay. I just lost the screen, but that's okay.
Just hit play there and you're good to go, I think. We can see, all of us can see your screen.
Okay. So which slide are we at?
Yeah, so if you just go onto your PowerPoint presentation and hit the full screen button, you should be fine. Go down to your PowerPoint presentation.
I don't have that anywhere now. Sorry. I see the control panel.
You just deleted your PowerPoint.
Let's see.
There it is.
There you go.
Okay. Got it. Let me blow that baby up. Okay.
And just hit play and you should be good. There you go.
Okay.
We're good to go.
Excellent. So there's our Tee It Up slide. We're off and running. So the best way to do co-discovery with your patients, as you can see, is with a photo. So the patient has the opportunity to see what you see and be a part of the decision-making process. You all remember that we always want to give our patients permission to share with us what they think, and they're really in the driver's seat to move case acceptance forward. So we do that when we connect them with what they see. The next step is to really link it to the M&M. We've got to find out what matters most to the patient, because we know that patients make decisions for their reasons, not ours. And so we want to connect their why with our treatment recommendations and lead with the M&M. So you always want to lead with their reason. So follow-up questions such as, what would having that do for you? How would that make you feel? It sounds like looking great is very important to you. Am I right? And how important is that to you, and why is that? So these are just some suggestions for some follow-up questions. Now, you always want to make sure, as you're using your follow-up questions, that your listening is turned on and you're feeding those responses back to them so that they end up giving you even more information than what you asked for.
Tanya, there are a number of people that are having trouble hearing you, so if you would be sure to speak up, that would be great.
Got it. Okay. So the next step, I'm sorry, I just need to make one adjustment to this PowerPoint. Like, use the right one. The next step is working through the urgency formula. So Steve, can you share with us your take on developing the 3 degrees of urgency?
Got it. So this is all based on, again, we're talking about the whole team's participation in financial arrangements. And one of the things that we're trying to avoid is after the patient leaves, the rest of the team coming up and asking if the patient's scheduled or not. And so it's the entire team's responsibility to make sure that the patient's on board with the treatment, that they want to do it, that they're good to go with it, and so that the financial coordinator's job then is to figure out how they're going to pay for it and when to get it scheduled, not if they're going to do it. So part of that is making sure that everybody's on the same page and that the patient has the same level of urgency and wants to do it as much as the team does. So as Tanya's mentioned, once you've discovered what matters most to them and you've identified what it is that they really want, you're helping them get that. And then you can make sure that you communicate it with the right level of urgency. So there's 3 steps in the urgency formula. Some of you are familiar with this. It's one that ought to be reviewed and practiced every day because this is a daily skill. There's 3 parts to it. One is expressing the appropriate level of urgency on the front end. So when you identify things that need to be addressed, some of the key words that are up on your screen is to communicate it by saying, Tanya, I'm very concerned about what we're seeing here in terms of the level of infection in your mouth, or I'm very concerned about these 20-year-old fillings, or I'm very concerned about whatever it is. Variations on that are, you might say, so Tanya, I'm very concerned about the bleeding that we see, which is a sign of infection. And anytime we see this, I am not comfortable just letting this stay this way because we know it never gets better on its own. It only gets worse. And it's just not a healthy state to stay in or to be in. So the key words here are concern, not comfortable, I don't believe it's healthy to stay. So the way you express the level of urgency in the current condition is the communication there is key. So that's the first step, is to communicate the level of urgency. Second step is to make your recommendation. And these are the exact words that we suggest is, I strongly recommend. So Tanya, in situations like this, I strongly recommend that we get started immediately with treatment to get that infection out of there, get everything cleaned up so you can get back to a healthier state and keep your teeth. So you make your recommendation by using the word recommend. That's what they're coming to you for, is your expertise and your recommendation. They don't want to know what everything that you know. Let me say this again, because this is one of the biggest traps that we get in dentistry, is patients don't want to know as much as you know. If they did, they would have gone to dental school. What they're coming to you for is they're coming to you for your expertise and your recommendation. And so you need to make a recommendation, not a bunch of options. In other words, patients do not want someone for you to say, well, you could do this, or another option is you could do this, or you could do this. The more options you give your patients, the less urgency they will have because they got too much to think through. Now, I totally understand informed consent, but our recommendation here is to say, Tanya, based on what you said you wanted and what you wanted to accomplish, I strongly recommend that we get started today and schedule your gum therapy so we can clean out this infection, get your teeth healthy again, and what that consists of, and explain what's involved, but make your recommendation. Now, if it's a restorative issue, you'd say, Tanya, based on what you told me you wanted to achieve, here's what I would recommend, knowing what I know now. Make your recommendation. Say, now, there's other options. There's always other options that, in my opinion, will get you less than what you said you wanted, but we can always go through the other options. But if it were me, based on what I know and what you said you wanted, this is what I would recommend. So that way you've covered yourself. So express the level of urgency, make your recommendation, and then third, identify the go forward step. What is the next step? So you want to identify the next logical step to get started. So I might say, Tanya, do you see anything standing in the way of moving forward? Do you see any good reason why we shouldn't get started? And then what I even prefer is to say, Tanya, if we could get started on this today while you're here, would that work for you? Or you might turn to your dental assistant, if it's the dentist, and say, would you see if next Tuesday morning is still available? I think we have a spot open where we could get started on this right away. In other words, identify the starting point and the next logical step, because it's once you get agreement on that, now you've opened up the way for the financial coordinator to focus on financial arrangements and the schedule. So let me just reiterate this. if a patient goes to do financial arrangements and they are not committed to treatment, then the rest of the team has not done their job. Let me say that again. If the patient gets to financial arrangements and they're not committed to the treatment plan that's been outlined, that means we have to go back and rework what's going on in the treatment room. The patient should be committed to treatment. The only thing then that is in question is how are the financial arrangements going to be worked out, and what's the exact schedule. So that's why the entire team plays into this. If the financial coordinator is carrying the burden of getting the patient to accept treatment and trying to explain all that, then we've put everything at a significant disadvantage. So they ought to be ready to go. Only thing they're now waiting to talk about is how are we going to budget this out? How is it going to work financially, and when are we going to schedule it? So that's why it's critical that everybody on the whole team is on board with this and doing their part so the financial arrangements can be successful. All right, Tanya.
All right, so to recap, setting our financial coordinator up for success involves a clearly agreed upon condition, identifying the patient's M&M, and always leading treatment recommendations with their reasons, and then finally using the urgency formula with strong commitment questions. So that's how we set it up for success in the back. Now we've got to link that to our financial coordinators. So you all know the weakest link is what causes the biggest problem. So linking it up to the financial coordinator really involves what we now call W5, the who, what, when, where, and why for financial arrangements. So this is really, in essence, your blueprint for success to getting all of your information in your link and carried over to your financial coordinator. So W number 1 is who. And we all know that the patient is the who. So we lead with the patient's wants. Again, not the doctor or the practice wants, but the patient. Next is the what. So what we're going to do, then when we're going to do it, and where is right here in our office today. And most important is that 5th W, which is the why. So a successful relationship link incorporates the emotional M&M, the reason why we're going to do what we're going to do, when we're going to do it, with who and where. So the W5 is the key to your relationship link.
So Tanya,
there are many people that are still having trouble hearing you. Can you put your microphone up right in front of your lips so that we can all hear?
I have it practically in my mouth, but I'll try to talk louder.
Thank you.
Is that better? Okay.
Yeah, I think so.
Steve,
if I can just reiterate, if I can just reiterate on that last point, that's a great formula to practice when, and I'm a big fan of choreographing and having a dress rehearsal on relationship links on a regular basis, because it's one of the first things that comes unraveled. And to practice that with the W5, who, what, when, where, why. And that you're not done doing the relationship link until you have communicated to the next person all 5 of those things. So it's a great formula, especially the last one, the why, which is why is this important to the patient? That's the M&M.
Got it. So step 3 is creating our toolbox. So we all know if we were going to go out and do a plumbing job, we would have a certain set of tools we would do to do that job. And no successful plumber would ever show up on the job without their toolbox. So our toolbox for financial arrangements has several pieces to it. The first piece to successful financial arrangements is developing your system. And we all know that 94% of success is in the system. So what is the first piece of your system? And that is the signed financial agreement. So you have, before you can prepare to speak to your patient, there's some work to do to get our financial arrangements form prepared. Now, we recommend our top easy pay options for dental treatment for a couple of reasons. The forms that come out of your dental practice management software can often be very confusing. And in fact, if you're trained on one software and you go somewhere else and look at someone else's printout, you too are usually confused. I know I am. So our easy pay options for dental treatment makes things clear and concise. And not only is it a place to list out our fees and our estimate of insurance savings, but it actually outlines our financial options. So the patient can make a choice and a commitment to said financial options. So let's take a look at what's on the form. We would, of course, put who, the patient, what, the treatment, and next we're going to put in our case fee. So rather than looking at each piece line by line, PFM, build up, crown seat, comp, res, fill, we're going to actually use layman's terms, a crown and a build up with fillings on the upper left, inclusive of a 5-year warranty. And then we're going to put our total for all of the treatment on one line. This eliminates confusion, and we all know confused customers or confused patients tend to do nothing. Next, we're going to list out our estimate of insurance savings. And yes, that was insurance savings, not benefit, not payment, not amount, not copay. Words really matter. And so we want to make sure we use the correct language when we talk about insurance. And finally, our estimated patient portion. So this is the part where we're going to start navigating through our financial options. So on the line 1, you see prepayment courtesy. Now, I know a lot of times we look at our fees and we think, well, we may be contracted, so we're concerned about giving in an additional discount. But I want you to think of this internally as a bookkeeping courtesy. So what this means is you're in essence buying confidence and security that that patient's going to return for their appointment, and you're eliminating multiple team members with multiple attempts to collect money. So we offer the prepayment courtesy so that we can keep our bookkeeping clean. I have found over the years that anytime we start to chase money, meaning we have to send billing statements or make collection calls, particularly if that draws out past 30 days, we end up spending much more than the 5% that we could have given to be paid in full. And then the next step is our no down payment options. So we have options for third-party financing so that the patient is still paid in full. And again, we have that commitment to the appointment. So separating the financial arrangements from the day of the appointment is very instrumental in keeping a full and firm schedule. It also eliminates bottlenecking at the front desk because patients aren't having to stop and pay at the end of the appointment, at the end of the morning, or at the end of the day. So it keeps things clear and concise. Finally, third option is offering 3 payments. You can do 2 payments, you can do 3 payments, but again, down payment is due today to secure my appointment. So we want the patient financially committed to the time in the restorative or the perio chair. Another tool in our toolbox is a clear understanding of the financial guidelines. So taking time with your team to review this form, to review our options, so that everyone in the office can confidently discuss the fact that we offer great financial options. We've helped many patients just like you, and we know we can help you too. Another tool in your toolbox is making sure we're clear on how we handle insurance assignments. Making sure that the patient is clear and making sure that the team is clear so your insurance aging report doesn't get out of control. The last tool in your toolbox is really all about us, making sure that we are dressed for success, that we are confidently prepared to present our best to our patients, and making sure that we have the tools to match. So we want to make sure that everything in our office is clean, neat, and organized, and that we're ready to present our very, very best each and every day. So step 3, where do we do financial arrangements? Well, sometimes I found it's better to talk about where we don't do it. The worst place to do your financial arrangements is at the front desk, over the front desk counter. That turns the situation into a transactional system. And remember, we've just spent a lot of time in the back creating great relationship with our patients. We've found their M&M, and we want to link that together in a relationship setting. When we move to the front desk, you all know how that looks. Your patient's looking at their watch, they're on their cell phone, and mentally they're checked out. They've moved on to work or school or wherever they're heading next. So that's why we recommend our first choice, which is to present our financial arrangements chairside in the operatory. And you can see this beautiful operatory we're looking at. We want to pull that doctor's chair over, and we want the patient sitting up, knee to knee, eye to eye, and getting a link from our fellow team member right there in the room. Now, some of you have space issues, and you need that room right now. So here's Plan B. So Plan B says if you can't stay and present the treatment chairside, at a minimum, you get the relationship link chairside. The patient's physiology is the same, the emotion is high, and we make that transfer of the who, what, when, where, and why right there in the room while the patient's still involved in the process. And we can even pull up our photos and visually link that information as well. If you have a consultation room is going to be the best place to then take that patient. Somewhere where you can have privacy and you can eliminate the distractions of people coming and going. So consultation room, best thing to do is have your computer available, have your information handy so that you're ready to present your very best each and every time. Steve, do you have anything you'd like to add to that?
You know, just the one additional thing, let me reiterate, because we talk about this a lot. If there is any possible way you can schedule and do financial arrangements in the treatment room, everything that we've done over the years has proven that the success rate of getting treatment acceptance while the patient's still in the treatment room is much higher than if you move them to a different location. If you can keep them in the same place, then you have a much better chance. So I realize it's not always possible, but there's a lot of psychology in this. If you can go to the patient instead of the patient going to you in a different location, once they get up out of that chair, when the physiology changes, the thought process changes. And the moment their feet hit the ground, their mind just went out to the parking lot in the car and on to their next commitment. So if you can keep them in the treatment room, much better success there than moving them.
All right, great. So next we have to talk about the brief system. Now I know many of you are familiar with brief and many of you have incorporated it into your office, and this is really the system for excellent financial presentation. So we have discussed the emotion in the room. We have gotten a clear agreement of the recommended treatment. We've gotten commitment from the doctor for the next clinical step, and now we've linked it up to the financial coordinator. There's a lot of repetition here, but that's by design. That's on purpose. So when we start our financial arrangements process, we want to go right back to the benefit. And the benefit is the M&M. What was the reason? What is the why for our patient to move forward with treatment? Now let's just talk for a minute about the differences between benefits and features. What happens, and this is when Steve said this is a team affair, not a financial coordinator event. What happens when the financial coordinator is left without the M&M, without the benefit, the only thing that they can start to talk about are the features. And that's when we start to have to digress into areas like, well, you know, we use really good labs. All of our crowns are made in the USA. It's really expensive, and we start justifying our fees because we don't have an emotional benefit. So we start talking about the features, such as, boy, doctor sure has gone to a lot of CE, or we sure do have a state-of-the-art facility, instead of talking about what really matters to the patient, because they don't care where your crowns are made, and they don't really care what type of materials you're going to use or that your costs are higher. So we have to talk about the benefits, not the features. So if I were going to talk to Steve and present a financial arrangement to him, I would go right back to the M&M, and I would say, Steve, so if I understand from Pam, you're ready to get started taking care of that tooth on the upper left because you want to avoid any pain and you want to avoid any surprises like you had the last time with your last broken tooth. Is that about right?
That's it.
All right. So the benefit is to Steve. Moving forward with the treatment, what's in it for Steve? Next, I'm going to review the plan. So just to make sure, Steve, that we're all on the same page, doctors recommended for you to get that so that you don't have any surprises. He's recommended a crown with 2 fillings on the upper left. Does that sound right?
That's right.
So I'm not going to explain how a crown's made. I'm not going to discuss how fillings are done. I'm just going to make sure that when I introduce the fee, that Steve knows exactly what we're talking about. You've all been in that situation when you started to do a treatment plan with the patient, and you mentioned taking care of those cavities, and the patient looked at you in horror, scrunched up their face, and said, "What cavity?" He didn't say anything about any cavities. we want to make sure that we don't enter that twilight zone. So we review the plan. And next, we introduce the fee. So again, this is done with our financial arrangements form that I showed you on a previous slide. And I'm going to simply say, great, so your total to get that taken care of, Steve, is $1,700. We estimate your insurance savings to be $800, and that's going to leave your portion at $900. And then I pause on purpose. So I want to give the patient a moment to hear what I have to say, because if I keep talking, they can't hear me. They're thinking about the $900. They're thinking about their checking account or their credit card account, and they're perhaps even thinking about the school pictures that they need to pay for Sally, the broken dryer at home, or they may even be thinking about that trip for spring break to Disneyland. So I want to give them a moment to hear what I have to say, and if at all possible, I want the patient to be the next person to speak. So I introduce the fee with a pause, and then I start to go through and explore concerns. So exploring concerns is talking about the ways that most of our patients choose to take care of the financing. So most of our patients, Steve, love the fact that we offer a 5% courtesy when you prepay. And in fact, not only do they love that, but they also love that we offer it for cash check or credit card. How does that sound? Again, wait.
Good.
Excellent. And if Steve's on board and he thinks that's a great plan for him, then we're done. I'm going to have Steve sign my commitment page for financial arrangements. I'm going to take his credit card and schedule the appointment. And 80% of the time, this is the end of financial arrangements when you do it that way. So let's go back and dissect how that happened. I incorporated the natural law of the herd. People want to do what they perceive others to be doing. And when I say, here's what most of our patients love about what we do, they love that we offer a chance to save some money, and here's how we can make that happen. And so again, I'm giving all the benefits to the patient for why they should do what they see other people doing. Now, if that doesn't work, the next option that we want to explore would be third-party financing. Now, some of you might be thinking, well, why would we do third-party financing first? Why wouldn't we jump right to in-office payment plans? Well, the reason for that is because when we offer in-office payment plans, we now have to become the bank. And banking is an expensive business, left best to the professionals. So we offer third-party financing because this will, in effect, give us the same result as prepay with the courtesy, because everything will be paid in full. Now, I want to just remind you, doctors, that it's really critical that before you start jumping to phasing treatment, that you get a clear commitment from the patient on the treatment, because if they're going to use financing, phasing treatment by the quadrant or phasing it by the tooth may not be the very best way that they can pay for that. So you want to make sure that you leave the door open for third-party financing for the total amount. So what's our frame on third-party financing? How do we offer Care Credit or American Healthcare Lending or Springstone? Do we always jump right to 12 months no interest, or do we explore other options? We recommend that you always begin with the low fixed rate option first, because that's going to cost the practice less. Now, I mentioned before on the prepay courtesy with a 5% discount that would still be better off than chasing money later on. Well, when we offer 12-month no-interest financing as our first option, we've already lost 10%. So you can do the math and see that a 5% prepayment courtesy, even with a credit card, is still going to cost you less than 12-month no-interest financing. So that's why we suggest always offering your fixed rate plans first, and depending on the program that you use will determine your discount rate. Finally, when do we do third-party financing? Well, we do it now. I know you're busy, you have a lot to do, and you have other patients waiting to be seen. But there is an inverse proportion to time and case acceptance. And you're going to hear me say that again a little bit later. But if we send the patient home with a brochure and an instruction to check it out online, the chances are that's not really going to happen. So we want to go through the process to explore our third-party financing right now. Our last option is offering an in-office payment plan. And there again is a system that you can set this up for success. First of all, you must have at least half down to secure that appointment time, and you want that paid before the appointment. Half down typically will cover your costs so that you're not really financing treatment. Secondly, you always want to make sure that you secure your payments with a credit or debit card. Now, one of my favorites is one of our strategic partners, Payment Alliance, actually has an awesome program where you can go right online and set that up and not have to manage it. Those payments are automatically deducted each month when you tell them to, and then you get a reconciliation each day showing you what payments have posted to your bank account. Finally, what to do with long-term patients who have always done it this way? Well, I have found that when we offer our always done it this way patients who pay at the time of service, when we offer them an opportunity to save money by prepaying, They love that we're thinking about their finances. If you have somebody that's one of those A++ blue patients that always do everything you recommend and they always pay, don't allow them to create your policy. Manage that exception and treat people based on who they are and who they've been in your practice. But the financial arrangements brief system, the 3-pay option, works great moving forward with all of your new patients and most of your existing patients. So finally, do you have anything else you want to add on the financing, Steve?
No, you're good. Keep going.
Okay. So last is to finalize the commitment. Money down is a commitment. Now, I know many of you listening, in fact, I literally know many of you listening, and I know that you enjoy the day at the spa, you enjoy traveling. There are many things that you enjoy that require money down in order to reserve your time. So that is the way that you know without a doubt that your patient is going to show up for the appointment. We call this the vaccination against the financial flu. Next is making sure that finalizing our commitment is done with scheduling the appointment. Now, how to schedule? We want to make sure that we're scheduling to meet our production goals, not just to fill a hole in the schedule or not just to fill up the yellow space in our Dentrix book. So we want to be really clear about the schedule in our head, and we want to have that up on the screen. And don't worry, your patient can't read your practice management software. They don't know what's on that schedule. So you want to offer options based on what works well for you. So for example, if you know that your doctor does crowns in the morning, then you want to say to your patient, Steve, Monday through Thursday, which morning on one of those days would work very best for you?
Thursday.
Thursday, excellent. And on Thursdays in the mornings, we have either an 8 o'clock or a 10 o'clock. Which one of those would be better?
You know, earlier is probably better for me. Let's go with 8.
Fantastic. So then, Steve, I have Thursday, March 20th at 8 a.m. Will you be here?
Let's do it.
Excellent. So I'm going to incorporate the law of commitment by asking a complete commitment question. Will you be here? So the last step, what do we do if they don't schedule today? Wouldn't it be great if every patient scheduled every appointment every time today? That would be wonderful. But reality says that there will be patients for one reason or another who will have to have a follow-up in order to schedule that next appointment. So if Steve had said that, then I would say, Steve, it sounds like you need to think this over and discuss this with Cheryl. I know most patients tell me they go home and discuss something of this magnitude right away. Would it make the most sense for me to call you tomorrow in the morning or the afternoon to follow up?
Tomorrow afternoon would be great.
Fantastic. So I'm going to pull up my schedule, and this is just an example of a Dentrix schedule. And if you see that OP3 column, that's my column. That's my administrative column. And I'm going to go look at that calendar, and I'm going to now say, well, Steve, I have either 2 or 3 o'clock. Which time would work best for you?
Let's do 2 o'clock.
All right, great. So, whoa, I lost my PowerPoint.
There you go.
There we go. So I'm going to schedule that appointment. Does that look right?
Nope.
Hey, sorry about that. I'm going to actually schedule an appointment with Steve tomorrow at 3 o'clock, and I'm going to put it on my appointment book so that I know at 3 o'clock tomorrow I have a commitment to follow up with Steve. Now, remember I said a little while ago that I was going to bring up the point that there's an inverse proportion to time and case acceptance? Well, this is where it is, folks. Our patients have the point of emotion the highest right now when we've just discussed this. And you all know that when you go home from the car repair place or the appliance center or wherever that you've been looking at products or services, that if you really have to discuss it with somebody, you're going to go home and do that today. Chances are you're not going to suddenly talk about it in 2 weeks. So don't make the mistake of putting your patient into a treatment tracker in Dentrix where it disappears and then calling them 2, 3, or sometimes even 4 weeks later. The message we send when we call that long away is that we're desperate to fill a hole. So we want to be on purpose, we want to create urgency, and we want to schedule the treatment follow-up within 24 to 48 hours. So how do you do that? You use the TOPS treatment plan tracker to keep score and have a plan to do your follow-ups every single day, just like you do everything else every single day. So finally, when is it time to stop? Well, as with our treatment acceptance, we want the patient to lead the decision making. So when I schedule that follow-up with Steve tomorrow and I call him tomorrow, I'm going to let Steve dictate how often I continue to follow up. Now, if Steve didn't answer his phone tomorrow, I'm going to leave him a voicemail saying, Steve, I was calling like we agreed to have a discussion about making sure that you don't have any pain or any surprises like you did last time you had a dental problem. Would you please give me a call at blah, 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 blah. Notice I didn't say, Steve, I'm calling about your crown. I'm calling about your fillings. I said I'm calling about his M&M. So I want to make sure that even my treatment plan follow-up, my list has that M&M, so I go back to it each and every time. Now, my recommendation for an appropriate amount of follow-up would be an initial call after 24 hours, 2 days, 2 weeks, and a month. But each time I want to make sure that I'm scheduling it, and I'm going to tell the patient that if I have to leave a voicemail. At the 1 month mark, if I still haven't been able to get a hold of the patient, I'm going to let them know that I was following up with them like they asked me to, but I don't want to pester them, but I also don't want to drop the ball, so I'm going to put the ball in their court to communicate with me. And then we can re-enroll them at their next hygiene appointment by doing our conversion exam process. So we want to link it up with the M&M and make sure that we make a plan to talk about it at their next appointment. And that brings us to our last natural law, which is the rule of 15. And the rule of 15 says that there are only so many people that are going to say yes after the first time, but by the time we get to the 15th ask, 90% or more will have said yes. So remember, lack of response today doesn't mean no, it just means not right now. Steve?
Excellent, Tanya. All right, so we have some very pointed questions that I think everybody will be interested in, so we're going to jump into those. Let's go back to the prepayment offer, the 5% if you paid today. So on the prepayment offer, do you have to offer all forms of payment, or can you just offer it for cash or check only?
Well, that's a great question, Steve. In fact, it's pretty common, and I hear it quite often. And, you know, I'm a big believer in the keep it simple method. I always recommend we want to make it easy for patients to do what they should do, and we want to make it more difficult for them to do what they shouldn't do. So easy to me is we just offer it on all forms of payment. And remember, let me clarify, cash, check, or credit card, not third-party financing. So the 5% prepayment wouldn't be an option with your Care Credit or your American Healthcare Lending or your Springstone. But even with a credit card, if you're partnered up with a great provider, you should still only take maybe an additional 2% discount. So you're really only at about 7%.
Got it. Okay, so then along with that, the 5% courtesy is just for the patient's portion only, not the full amount of the case, correct?
That is a great question. Yes, so that is for the patient portion, unless, of course, there is no insurance savings, at which point it would be for the total amount.
Perfect. When presenting financial arrangements, we talked about doing that in the treatment room. Question is, do you recommend a dental assistant presenting financial arrangements or the financial coordinator coming back to the treatment room?
Oh, that's a good one too. So, nowadays there is a lot of cross-training that's happened in our practices. So if whoever is confident and capable to present the financial arrangements is who should do it. So I wouldn't just throw somebody in to do it if they weren't prepared. But if you are an assistant and you feel confident and you have the time and you're prepared, I say go for it.
Excellent. Again, just for clarification, presenting financial arrangements in the treatment room is better than the consult room, correct?
So our first place that we recommend is in the treatment room, yes. And that is because of a law of physiology. So when the patient's in the room, we've just made an agreement, and they're still plugged into that appointment, they're present, then if we can present chairside, it gives us a leg up. And as we've tracked this over the years, we've just found that the practices where they present chairside have a better case acceptance on financial arrangement. So the answer to that is yes.
Question about what we presented today, just as a reminder to everybody, this webinar will be posted at crowncounsel.org later today under the training tab under webinars, so you can go back and review. The easy pay form, Tanya, that you talked about, that we went through and dissected, if anybody would like a copy of that, you can shoot us an email and we'll be happy to send you a copy of that as well. And as well as the treatment plan tracker, correct?
Correct.
Got it. So the next one is our office used to hold credit cards on file. Now with the new credit card security laws, what are your recommendations?
Great question. So that is why I recommend partnering with a credit card processor that has a system to capture that. I know for sure that Payment Alliance, and you can get their Crown Counsel resource partner information at crowncounsel.org. I know absolutely for sure that they have PCI compliant system in place to capture that information, and it's super, super simple for the dental team. If you're not using them, you might check with your current credit card processor to find out what options they have.
Okay. Next question is, I thought we couldn't give a courtesy to patients on the patient's portion if they have insurance.
Excellent question. I was waiting for that one. So, according to your contracts, if you are contracted, you are obligated to charge the patient, to collect rather from the patient what you say you're billing the insurance. So in the event that you offer a courtesy, your obligation is to tell the insurance company. So in the field on the insurance claim where most of you put your narratives, you can simply put in there that you intend to offer the patient a 5% courtesy on their portion, and that will satisfy that obligation. To date,
as long as you disclose it, you're fine.
You're disclosing it. Exactly.
Perfect. Excellent, Tanya. That concludes our questions. Thanks for being with us today. And thanks, everyone, for joining us for our webinar today. More to come, obviously, in the months to come. And our goal with the webinars is to provide skills-specific training that will help you get better results with your patients every day. So thanks for joining us today. Again, this will be posted at crowncounsel.org under the training tab under webinars. If there were members of your team that weren't able to participate today, you can go back and they can view the webinar. A lot of material here for the entire team. because financial arrangements is a team sport. It's not a wrestling match with the financial coordinator. So thanks for being with us today. Hope you have a super day, and join us again for our next Crown Council webinar. Have a good day, everybody.